I learned that when my urine culture test showed no bacteria, it was probably because the threshold of the bacteria I had in my system did not meet the threshold of the test. Hi, my name is Bronia. I live in Montreal, Canada, and I'm here to share my story of my UTI experience throughout the many years that I've had UTIs. I realized that I have had UTIs for about 50 years. I started off in my early 20s where I would get UTIs maybe once every 2 or 3 years. In my 40s and 50s, every 1 to 2 years. And in my 60s, they became more frequent, maybe 2 or 3 times a year. Then, when I was 67, I had chemo for cancer treatment, and immediately after that, the rate increased to 1 every 2 to 3 months a year. I had a relapse 5 months ago, and after immunotherapy treatment, I had a UTI every 1 to 2 months. The bacteria was usually E. coli, I would say about 90% of the time. I went to see my GP throughout my 20s to 50s, and the usual routine was that I got symptoms, and after 2 to 3 days, went to see him. He prescribed an antibiotic and asked me to go to the hospital to have a urine culture done and to start the antibiotics after I did the urine test. He never called me back to say if the antibiotic was good for the type of bacteria I had or whether I had no bacteria. I usually had an antibiotic for 3 to 5 days, and the symptoms usually went away 24 to 48 hours. 6 years ago, I had a hysterectomy. When I went for a checkup after a year, the gynecologist told me that she noticed that the urine tests from the past 4 times showed that I had no bacteria and I should see a urologist. I saw a urologist and she performed a cystoscope to check for cancer and any other abnormalities. There was no cancer, and she diagnosed me with interstitial cystitis and gave me a diet to follow. She explained that I may have symptoms of a UTI but no bacteria, so no antibiotics would be prescribed. Through diet and supplements, I may reduce the frequency of symptoms that cause my bladder to become inflamed. The objective was to keep a low level of acid in my bladder through the foods I eat. What type of treatments did I pursue? Well, I read about IC on the internet. I read the written material that the urologist had provided me with, and I reached out to people in a health food store to learn about supplements. A friend of mine who is a GP suggested I take D-mannose and probiotics as a preventative measure. I did so. I joined several UTI Facebook groups and learned about corn silk tea, a heating pad, and other supplements to help keep symptoms away. I was very careful about my diet for about 4 years and limited my consumption on the foods on my list of foods to avoid. As both my urologist and gynecologist recommended seeing a pelvic floor therapist, I did so 3 years ago, and that has helped with the lessening of frequent peeing. I continue the exercises 5 days a week. And to tell you the truth, it was kind of confusing for the past 6 years because I had frequent symptoms and did not know if it was an infection needing antibiotics or my IC, interstitial cystitis, acting up because of something I ate. I tried to wait for a few days with my supplements, corn silk tea, and heating pad to help manage the symptoms, till I finally went to see a doctor and had a urine culture test which showed a UTI and sometimes no bacteria. It became very stressful once the symptoms started with a tingling or pressure to pee, because it quickly progressed to pain when peeing and then pain all the times, sometimes for days. At that time, I took Tylenol and some other medications that are advertised to help with UTI pain. I was never sure and probably made the condition worse by waiting 3 to 4 days before seeing a doctor and having a urine culture test done, which took another 48 hours to get the results. So we're looking at about 6 or 7 days of no treatment. Over the years, I have read widely and consulted a naturopath specializing in UTI. I've seen a urologist and had 2 cystoscopes, tried many supplements from natural sources and different antibiotics for 5, 7, 10, or 14 days. And one time I had a period of about a year where I took a low-dose antibiotic as a preventative. That worked for about a year. Through diet and supplements, I was hoping my symptoms and my UTI frequency would diminish or disappear. The thing that made a big difference for my experience is that my friend, who is a GP, told me to take D-mannose as a preventative. She explained that the path to recovery is not easy. The medical profession does not really know why some people get UTIs and others don't. She encouraged me to get urine tests done as soon as I felt symptoms to rule out an infection and not wait. She calmed me down when I was afraid all these UTIs were going to lead to kidney failure. Last year I had 9 UTIs, and this year I already had 5 UTIs from January to July. The Facebook groups I joined were informative, and I saw the scope of the problem and how other people had worse conditions and a much more compromised lifestyle. I read Cystitis Unmasked by Dr. James Malone Lee, and that was a real eye-opener. I learned that when my urine culture test showed no bacteria, it was probably because the threshold of the bacteria I had in my system did not meet the threshold of the test, meaning that I had maybe fewer bacteria that showed up on the threshold of the test that was testing to see if I had bacteria. My symptoms always went away when I took antibiotics, whether I had an infection showing or not. I thought that that was interesting, because if there was no bacteria showing in my test, how come the antibiotics made my symptoms go away and seemed to stop my UTI for a period? I realized that I may have been contributing to my condition by trying to keep a low level of acid in my bladder through diet, but I've since learned that it may be better to keep a high level of acid, again, by diet. Things with vitamin C that I have been avoiding for the last 4 years. I saw a urologist a couple of months ago, and he referred me to an infectious disease specialist. At first I panicked, thinking there was a different underlying disease in me. But he wants to treat my frequent UTI condition, and he put me on a 4-month course of antibiotics. I knew to also take probiotics at the same time. I am now slowly reintroducing the foods I have been avoiding for the past 5 years. I had surgery 10 days ago to repair a prolapsed vaginal wall and to reposition my prolapsed bladder. The gynecologist did not think it would have a big impact on my UTI condition. The infectious disease specialist thought it would. I guess I'll see in a few months when things settle down whether it indeed did help my UTI condition. I have low antibodies due to the cancer treatment of 5 months ago and will soon start a therapy of antibody transfusions once a month for a year. That may be a key factor in strengthening my body against contracting UTI infections. I hope so. I realize that I have a predisposition to get UTIs almost my whole adult life, and since my cancer treatment, which lowered my immunity, my rate of UTI increased a great deal. This was complicated with the IC diagnosis, which may or may not be valid. Right now, I feel good. The surgery on July 22nd went well, only 2 days of pain and a bit of bleeding. I'm on the 2nd week of antibiotics and have a minor problem with loose bowels. I'm waiting to hear when I will start my antibody treatment. The downside of the surgery is that I cannot go to a pool or do exercises for the rest of the summer. I love the pool, as I usually do aquafit 5 mornings a week. I have degenerative disc disease, and at my age, walking is a bit of a struggle. I need support with walking sticks for a distance of more than a block or 2. I hope to get back to the pool in mid-September. My personal insights and the impact of all of this on me is that I have come to the realization that for the last 6 years I am dealing with 3 major issues: pelvic floor dysfunction due to a hysterectomy, frequent UTI and an IC diagnosis, and cancer treatment and the side effects. There are different doctors and different hospitals involved. I have to maintain the communication between the doctors and carry information from one to the other if I feel it'll impact the condition that I'm seeing that particular doctor for. I was relieved and grateful that my oncologist spoke to the infectious disease specialist regarding the timing of my 4-month course of antibiotics and the start of my antibody treatment. The oncologist thought we should wait till a few months have passed and see if I get a UTI. She consulted with the infectious disease specialist and agreed with him to do both therapies at once. That is very important, as I realized that some doctors did not like to hear about a diagnosis and its implications from the patients, and it's much better that it comes from another doctor. I brought up Dr. Malone Lee's book to the infectious disease specialist, and he did not seem interested in knowing about the book or about the things that I read that I thought were interesting and pertained to me. I didn't pursue the topic. So what I think makes my UTI story unique is that the things going on with my body outside of my frequent UTIs impact the frequency and maybe the root cause of my UTI condition for the past 6 years. But I have had UTIs since my 20s when the rest of my body was very healthy, so no complication then. I guess over time, with other medical issues, the condition definitely got worse, and even doctors and specialists don't have the perfect answer. I tried the natural supplements and diet control because I thought it would benefit me at the time. Now I realize I was treating the symptoms and not the root cause. I hope with all I'm going through and the specialists I'm seeing now, the answer will materialize and I will stop having UTIs. That's my goal, just to stop having UTIs or lessen them tremendously so that I'm not constantly dealing with them throughout the rest of my life. Thank you for listening.
Hi, I'm Bianca from Love. I hope you found this video helpful. There's no single approach that will work for everyone when it comes to health, so I invite you to watch more patient videos here or read more stories over on our website, liveUTIfree.com, and take what resonates with your journey. Remember, it's always best to consult with a clinician before trying something new. If you'd like to share your own story, please get in touch. Our info is in the description. And feel free to reach out with any question about patient stories, finding a clinician, or your own personal experience. Also check out the description below for more helpful resources. If you find these videos valuable and would like to support what we do, don't forget to subscribe and hit the bell button to stay updated when we post new content. Thanks so much for watching and for being part of this community, and remember, your story matters.